Did you know that acupuncture can greatly help with menopause symptoms? In today's episode, we're joined by Rumiko Kimira-Galzina, an experienced acupuncturist who's journeyed from Japan to become a holistic healer in New York. Together, we explore the importance of viewing health and wellness through a holistic lens, one that includes emotional well being alongside physical health. Rumiko will share her expert knowledge on the various techniques and how they can effectively treat chronic pain and alleviate menopause symptoms. Plus, she'll offer valuable advice on how to find a great acupuncturist and the crucial role open communication plays in the healing process. So tune in for an enlightening conversation that could transform the way you think about health. Aloha! Welcome to the Radiate Health and Wellness podcast, where we explore the vibrant world of health and well-being. I'm your host, Christine D. Ross, a board-certified health and wellness coach specializing in behavior change and nutrition, and author of Discover the Adventure of You and Health Beings. Join me as we uncover inspiring stories, practical tips, and transformative insights to assist you on your journey to radiate health and wellness. So, Rumiko, I would like to welcome you to the Radiate Health and Wellness podcast. So, aloha and welcome.
Thank you for inviting me.
You're so welcome. So, Rumiko, if you don't mind, tell me a little bit about yourself. Let's get to know you.
Okay. I've been in practice for 16 years now as an acupuncturist in Long Island, New York. I came to this country when I was 18 and studied just like everybody else and went into finance first. And I had issues of sciatica as a college student. And I couldn't figure out what's going on with my body and went to multiple doctors and eventually stumbled upon a more holistic way of treating it. First a chiropractor and then acupuncturist. So then I started thinking, well, which way would it be suitable for me to practice? And decided that the acupuncture is probably better for me. I'm small and there's no way I can adjust huge patients. So that's how I went into acupuncture.
Wow, sounds like you definitely had the learning curve and experience to lead and guide you into acupuncture. So
Mm-hmm.
let's go to the beginning from where you started. You said you came over here. Where did you come over from? And what was that experience?
I was 18 and I came from Japan. And I moved around the states a lot. Started in Oregon, then after ESL moved to Minnesota and studied there for a couple of years and went to Utah, then had to go back to Minnesota to complete my degree because the transfer didn't work out well.
Right.
So
So a
then
lot of
moved to
cold
Utah.
places.
Yeah, I liked Utah definitely. People are nice over there, and it's dry in summer, cold in winter. You know, I like skiing, so that was good.
Oh, what was your
Um,
favorite resort?
I didn't go too many. I believe it was Snowbird. I think I passed, went once. I mean, I was a poor student, so, poor meaning didn't have money, so couldn't go
Oh,
to many
yes.
places. Yeah,
Yeah, skiing can be expensive, but yeah, Snowbird
exactly.
living there, that was, I think, one of my son's favorite resorts to go to.
Yeah,
So, yep, known for
yeah.
the greatest snow on earth. So, you're in Utah, you
Definitely.
get to try the snow.
Yeah.
Yeah. So, Rumiko,
Mhm.
which I love that name. What a wonderful name. It's just fun to say, Rumiko. So, great name.
It's a little harder
So,
in English, but yeah.
it's a little harder in English. So, what is it in Japanese?
It's the Japanese R sound is closer to between the R and D, so it's more like closer toward L. So it's Rumiko, and there's no rolling tongue there.
Okay, so how would you prefer I say your name?
I'm used to English pronunciation, so
Okay,
Rumiko is fine.
well, Rumiko is fun to say. It's a great name.
Thank you.
So it sounds like you really went through a lot of health concerns on your own. So as you kind of sum up what health and wellness is, What does it mean to you to really just radiate health and wellness into the world?
The health and wellness, as you said, it radiates, but it radiates from within. So in order for that to happen, many aspects of health have to kind of align within a person. So we often hear about you have to do you have to take care of diet and exercise. And I don't like that phrase itself, but there's a half truth to that. You do have to take care of diet and exercise, but I will add emotional well-being on top of that. So that you have to have all of them to be healthy. And as we get older, obviously we have to work on it. When you are little or when you are young, you never think about these things. But as we get older, certainly we have to think about these things.
What is the reason why you would think about these things?
Being this profession, I've met so many people struggling with health. And it's just not one aspect of health that they're struggling, usually multiple layers of it. So when you look at somebody and said, this person wants to be healthy, that's not just pain free or lose weight. You have to have that emotional well-being on top of that.
Right. Sounds like you're really looking at your individual patients, your clients as the whole individual, looking at their body, the whole connection of who
Mm-hmm.
they are. So with acupuncture, I mean, that's your specialty.
Yeah.
You were telling me before that there's different types. So can you tell us a little bit about the type that you do and why you chose that certain type of acupuncture to perform?
Well, first of all, the most common type of acupuncture is called traditional Chinese medicine. Chinese medicine has been around for thousands of years. But in 1950 or so, the communist government sort of formulated the traditional Chinese medicine so that people can learn in school. And that's the mainstream type of acupuncture and pretty much in the world. And that's more of this style looks at the person with what they call the Zanfu theory, meaning that they look at the organ disharmonies. And I was more attracted toward the meridian theory, meaning looking at the meridians in the body instead of going straight to organs. And this kind of type of acupuncture was, much more popular outside of China. I guess because this kind of acupuncture sort of went out of China before communists took over. So you can find this kind of styles in Taiwan, Korea, and Japan. And where the school I went to, the Tri-State College of Acupuncture, had multiple styles of acupuncture taught in the college. And one of them was by Kiko Matsumoto, the Kiko Matsumoto style of acupuncture. And this is more palpation based. So I can go into the treatment room and talk to patients, and then I'll palpate the patient to see what's going on with the person. So I can kind of go into that room with a clean slate. Whereas for TCM, I'm personally more spleen deficiency type. So I tend to look at the person to sort of look at that aspect of the issues more so than others. So I'm not looking at the person with what's the word? I tend to look at the person with glasses on, that's my bias to it. So with this style, I was able to walk in and try to treat the person as is rather than how I look at the person.
So I like it. Really, yeah, personalized individual care, seeing what the person there in front of you and just feeling that using your intuition, it sounds like, of where they deserve the healing.
And that I can just walk in like, so what am I gonna do now? Instead of okay, this person must have some kind of spleen deficiency.
Yeah, that's great. And really probably comes down to actually healing the issue, what's going on in them that's causing their pain and discomfort. Instead of just doing the traditional medicine of just slapping that band-aid on it, taking that ibuprofen or pain relief, and it doesn't ever treat the cause. So it sounds like
No,
by yeah, you're really looking at the person and going in and healing the cause.
Western medicine has its, the benefit. It's definitely great for acute conditions like heart attack or you broke your leg. But when it comes to chronic condition, they really don't have a solution.
Yeah. So can you give us like an example of somebody with a chronic condition or maybe even like women you in our conversation before you talked about just going through menopause and perimenopause and how you've experienced working with a woman or an individual going through these types of conditions, how it's changed their life.
So first of all, I had a lot of women coming in for consultation this year, especially over the summer. And I realized that I would say about 35 to 40% of people walked in to just have a consultation, and some of them with treatment consultation were complaining about the issues which are typical of among perimenopausal menopausal women, and their complaints were not just hot flushes or mood swings. They were talking about mysterious conditions that they didn't know where they were coming from, and those are like uncommon conditions, uncommon symptoms you see in menopause, like body odor change or dry skin or, that kind of things. So until I pointed that out, some of them didn't even realize that was a part of the change they were going through. And also there were a lot of women coming in and complaining that they went to OBGYN and some of them asked for HRT, the hormone replacement therapy, and they got brushed off and say, just hang on, it's gonna go away. And they were frustrated more than anything. So they came in to see if acupuncture would help. And some of them are clearly just came in because they have no solution, not knowing that that was a part of perimenopausal or menopausal symptoms.
Yeah,
So
I didn't know that. You say like so skin conditions and body odor. Is there any other symptoms that, us as women should know about to keep an eye on that is part of menopause?
So I just saw an article yesterday in Huffington Post, the UK version. There were apparently 63 conditions of the symptoms women can experience, and the
Wow.
average is about 10. So, we can't cover all of them, but I hear tinnitus, dizziness, heart palpitation, UTI, joint pain. Those are the ones you don't hear often. And as I said, the change in body odor as well. But we always talk about hot flashes, brain fog, night sweat, vaginal dryness. Those are the main ones.
Yeah, none of it sounds like too much fun. So, how have you been able to assist these women through acupuncture?
So some of these people who walked in didn't take acupuncture. They wanted the quick fix. So that's one route. Obviously, we'll find something else, I'm sure, for those who stuck around. So first thing I look at in Kiko's, style of acupuncture is I palpate around. And often I find that their nervous system is imbalanced. So try to balance their nervous system so that the body is going to start align itself. Let's not forget the menopause and perimenopausal symptoms are part of the change. It's not like they have illnesses. So it's a little bit of misalignment that we have to fix. The great part of Kiko's style is the treatments for hormonal imbalances. So I'll take palpate around and see those certain acupuncture points are sore, then I will, use that treatment protocol. So in general, these women have the nervous system imbalance and the hormonal imbalance. Sometimes I will use detox treatment to get body accumulated, and they tend to help.
So, is the detox treatment something you do in office, or is there other things that, like homework, you give them?
Really depending on the person, but the Kiko's detox treatment involves about 4 needles. So I'll throw that in. And sometimes we'll use moxa on top of that.
Wow, I had no idea that acupuncture could do so much with just regulating hormones and detox.
Yeah.
That's pretty amazing. So, what have the results been like with these women?
It takes a while, but people usually start feeling better, start getting more energy, and then the frequency of issues like hot flushes or insomnia go down. It's a journey. It's not like you get a couple treatments and you are cured. This is just a process. One thing people have to remember about acupuncture is that it's a physical medicine, meaning that the efficacy is depending on how often or how many treatments you get. Of course, depending on the person, you might need one or two, or might need 10, 20. It's not like popping a pill. You do have to stick with the treatments to get the body to start healing itself.
So, a woman walking in that has some of these menopausal symptoms, she may get prescribed from the acupuncture to come back like a couple times a week, or like what can one expect for the treatment time and like how often to have treatment?
Ideally, a couple times a week. Definitely, that's the ideal. Even when you look at the books of masters from Japan or China, the frequency is much higher than here. If you go to China, it's every day. You have to go to a Chinese acupuncture hospital every day to get treatment. Here we sort of adjusted our the treatment frequency to align with more Western medicine. So you see a lot of them recommending once a week. But to be honest with you, once a week initially is often not enough. So you have to come in twice, three times a week for a couple of weeks or several weeks to see if you are getting better. Then once you are at a certain point, you should be able to have that frequency reduced once a week, every other week, and so on.
Yes, definitely a journey, which with everything health and wellness to really become truly healthy is that journey. It's not about the quick fix. It's about taking that time instead of the convenience of something quick. But in return, you get
Definitely.
something that lasts a lifetime. So, is
Definitely.
there any negatives, any drawbacks besides the time commitment?
Unfortunately, because the frequency and the number of treatments, financial, that's always a big hurdle. In my practice, I tell them upfront how many treatments we're gonna need to feel better. So at least I don't have, they don't have any surprises with me. But I'll try to assess as much as I can at the beginning how many treatments they're gonna need.
So besides working with hormones and menopause, you talked about your own sciatica. Is there other tendencies that people come in with a lot so that acupuncture is really a good fit for?
So majority of patients walk into my office or any other acupuncturist clinic, I'm sure, is pain related. Back pain, neck pain, shoulder pain, knee pain, and headache. Quite often they have gone to other modalities and they don't want to take pain medication. And that's when they usually walk into acupuncture clinic for help. Even though it's currently complicated, Medicare started covering acupuncture for lower back pain, chronic lower back pain. Unfortunate part of that is acupuncturists are not covered. So at this point, if you have a Medicare and you want to get treated for lower back pain, you have to go to other medical providers who are licensed in acupuncture. So you can't just walk into regular acupuncturist for that. But that tells you that even Medicare recognizes that acupuncture is helpful or beneficial for chronic lower back pain.
Yes, and I have Kaiser, and there's a plan with Kaiser that allows for acupuncture, chiropractic work, as well as massage. Now, I know
Mm-hmm.
massage, you have to have a doctor's recommendation for it. It's a little bit harder to get, but yeah, chiropractic, acupuncture, they're seen by these big companies as being treatments.
It does seem
Definitely.
like a little bit of Western and Eastern is colliding and creating a little bit of balance. So I see that as great news.
That part, yes, but unfortunately, just like everybody else, we do struggle with that issue as well. But that's not really the topic for this conversation.
Right, right, yes. Well, besides acupuncture, do you give your patients any homework, any changes to like diet, simple exercises, strength
Oh,
training, stretches?
definitely, stretch exercise is a big one. Some strengthening exercises, diet change. Quite often, unfortunately, we do see a lot of patients who are sensitive to certain food, and definitely gluten is on the rise. Dairy product is on the issue. So those are usually the first I ask them to eliminate just to see how they feel. Inflammation goes down without these ingredients or the nutrients. So that's definitely a part of that if acupuncture is not getting a great result. Also, sometimes we'll suggest something like, there are some people who have great healthy diet, but they might be taking smoothies every morning in the middle of winter. And I might suggest maybe something warmer. If that outside it's cold, then that's really not great to have cold breakfast, that
Okay.
kind of thing. So little things here and there I would recommend. It's just, people are not active. So always ask them to be mindful of that.
So with food, it sounds like the main concern where you first start is dairy and gluten. Is that right?
Definitely.
You brought up the inflammatory properties in these. Is that right?
Yes.
That these foods cause inflammation. Is there anything else?
It's sugar. Sugar is a big one. Also, ultra processed food.
Hmm.
It's I always tell my patients that the flour you grew up with is not the flour you are eating now. Gluten content is much, much higher than it used to be. So there are a lot of healthy foods that you think they are healthy, but they're not. And it's really difficult to, you know, figure that out these days.
Yeah, it really is. I mean, I'm a big one on food is your medicine, and what you put into your mouth is either going to cause disease or cause your body to be at ease. And to just make that mental note before you pick up that fork and put that bite onto your mouth of
Mhm.
how is this going to affect my body? And to really think about just mindfully eat what's going in on your body. Do you have inflammation? Is this food that's dairy, gluten, like you say, going to cause me more pain and harm to my body? Is it worth it?
Yeah, definitely. And it's hard
So,
to judge. Like gluten, you have to take it out of your system for a certain period of time just to see the difference. So if you skip gluten for a couple of days and didn't feel anything differently, some people just quit. This is not the issue. But it takes time for that to really get out of your system to even realize that was causing a havoc in your body.
so how long does it usually take to get out of your system?
I'm sure it's different from person to person, but I would say at least 2 weeks to see a difference. Some people, it might take a month or so.
So, do you have any recommendations for people that are trying to get rid that gluten out of their diet or the dairy? A lot of people just have such an addiction to cheese. Like, oh, don't take my cheese, my ice cream away from me. Like, I'm not going to be able to survive. What fixes have you found that have worked for other people to really assist them to replace the gluten and the dairy and the sugar with healthier alternatives?
It's difficult. It's really difficult. But if somebody feels better after taking whatever the either gluten or dairy out of their diet, that's like an aha moment for them. So they might be able to stick a little, better because they are feeling better. But if it's a subtle difference, then it's difficult. And if you go out and eat out, it's almost impossible to get gluten out of the diet. So it's a constant struggle for sure.
It is. Gluten seems to be in everything, as well as sugar and little bits of dairy. It's hard, but that's where
Yes.
I decided the 90% rule. 90% of the time, I can, make my own sauces, be really in control and in charge of what goes in my mouth. But then another 10% of the time, if I go out, not to stress over it. It's okay if I have a little bit of that extra gluten or sugar or dairy in something. Because to
Hmm.
me, the stress is so much worse on you than having to be in that constant fear and state of control. How do you feel about that?
Definitely. I tell patients like 3-day rule. So if you go out and eat something, it's bad for you, or you went to a company party, you couldn't avoid the things you don't want to eat, then I tell them next 2 days, eat well. So at least you look at it as a 3-day span, so you don't feel bad about it, and also you can always, correct that next day or day after.
Yes. Yeah, just not having that all or nothing approach of, yeah, I ate the cookie, gotta eat the full box. Yeah, tomorrow
I
is a
don't
new
know the
day. It's
whole
okay.
box is gonna be fixed in 3 days, but yeah, I mean that's the idea.
Well, Rumiko, for somebody that's just looking into getting started with acupuncture, do you have a message of how to start, where to begin? What's your message for them?
The first thing is that you have to find a reputable licensed acupuncturist in your neighborhood. That's the first thing. Believe or not, some of them are not great. So, you ask around, even the Google reviews, you know, as long as it's not, well, the fake ones in there, it's somewhat reliable. So you can look at that way. So make sure that you get reputable licensed acupuncturist and call them up and find out if they offer consultation only, whether it's paid or free. So you can at least talk to the person and then see how you feel. This is not only the treatment you are looking at, but you are looking at the compatibility with the acupuncturist as well. This is medicine, but also art. So,
Right.
the style of acupuncture the person is specialized in that may not agree with you. So it's a good idea to at least get the consultation and have a conversation with the acupuncturist and then go from there.
Yeah, I mean, it really just sounds like you really do just a nice personal approach and make sure that it's a good fit between the different acupuncturists and the clients, just to be a good fit, to have that trust, to be able to surrender and allow somebody to put needles all over and you can be huge for some people. So,
Definitely.
is there just any other just personal messages that you would like to share today?
The body has a power to heal itself if you nurture it. So if you have issues like just can't start, you don't know where to start, find somebody that can help you. And it doesn't have to be an acupuncturist, could be a friend, but you don't like a buddy system. You need encouragement. And for me, as an acupuncturist, I'm a cheerleader for my patients. I always encourage them, nudge them. I always ask them where they stand in terms of either the diet change or the exercise, so that sort of putting the accountability to it. And if you can find somebody like that, it doesn't have to be acupuncturist, but your success is gonna be higher.
Yeah, support. Like I talk about in one of my books, having the aloha friends, somebody there that you can count on, rain or shine, to be able to just talk to support you in your decisions, whether you decide to go Western or Eastern medicine, to just be there. So very
Yes.
powerful. So Rumiko, is there a way that if anyone has questions for you or wants to contact you, how can they do that?
I'm on Facebook and Instagram. I can send you the link to those, the sites. And also, I have a free ebook about menopause, acupressure for menopausal and perimenopausal symptoms. I can send you a link for that as well.
Okay,
Just
yes. And if you send that to me, I will put that in the show notes. So,
great. And just, I want to emphasize so the acupressure book is to help you support your journey through menopause and perimenopausal symptoms. But I highly recommend to get the personalized care from acupuncturist. Acupressure points are great for certain conditions, but these are usually empirical points, meaning it works for everybody. But to get the full support, the complete package, definitely you should consult acupuncturist.
so just one more question that I thought of with consulting an acupuncturist to make sure it's a good fit. Is there any signs that one should look for? Any red flags of don't work with that person?
Well, first thing is that the clinic should be clean. That's the first thing. And whether or not they use disposable sterilized needles, those are basic things. Some states probably allows reusable, but like New York State and most of the states only allows disposable needles. So, you might want to pay attention to how the clinic is set up, treatment room is set up. Those are just basic things. And also that the paperwork look, complete, because there are a lot of legal paperwork you have to fill out, and that's also the basic thing to check. The other thing is really just I'll ask a lot of questions, and it's the communication is the key.
Wow, well, you've definitely provided a lot of guidance and places to start from, what to expect, and how the journey really looks overall. So, just wrapping things up today, Rumiko, is there anything else that you would like to share?
When you go to acupuncturist and if you communicate what you want to get treated for the symptoms, make sure you give a thorough history and any other issues you are having. I have a lot of patients coming in for back pain and neck pain, some unrelated issues, and 3 months later they might be telling me that my PMS is better, my period is regulated now. It's like you should have told me 3 months ago, then I could have worked on that, and you would have got a better result and sooner. So make sure to tell everything you want to tell.
Come in as an open book, just lay it out. Here's what's wrong with me, fix it.
Yeah, and acupuncture is gonna try to organize that and try to treat that in order of importance.
Yes. All right. Well, thank you so much. So much great information. And I feel a lot better to reach out to an acupuncturist now, just knowing a little bit more and how you can heal so many different things at one time. So, yes, thank you for coming on and sharing today, Rumiko. I definitely appreciated your guidance.
Thank you for inviting me.
Mahalo for joining us today and for listening to Rumiko's incredible insights into the healing power of acupuncture. If you're dealing with chronic pain, menopause symptoms, or simply curious about holistic health, we hope this episode gave you valuable tools and information to consider. And if you know someone who could benefit from the messages shared today, please share this episode with them so they can learn about these powerful healing techniques. Also, be sure to follow and subscribe so you never miss an episode. And for more resources, blog posts, and health coaching, visit my website at radiatehealthandwellness.com or reach out to me directly at radiate.hw@gmail.com. You can also contact me on Instagram or Facebook or simply leave a comment below. So until next time, take care of your well-being and keep radiating health and wellness in all that you do.